Japan's health ministry has reported 99 new COVID-19 infections on the Diamond Princess cruise ship. That raises the onboard total to 454.
Well, on land, the total number of confirmed cases have risen to 65. And Japan has warned that the COVID-19 outbreak is entering a new phase. It urged people to avoid large gatherings as it continues to battle the virus.
Fears of the virus spreading have prompted authorities to cancel some major events. These include a public birthday celebration for Emperor Naruhito. The Tokyo Marathon will be scaled down, with the amateur race portion to be dropped.
Meanwhile, the Japanese health minister has said that the government is working to expand its testing capabilities for the virus, and it's set to work on that with universities and private firms.
Michio Ishida has the latest from Tokyo. She joins us now. Michio, with the surge in the number of infections on the Diamond Princess, how likely are the passengers to be allowed to disembark when their quarantine ends on Wednesday?
Well, we've been hearing that swab tests are being conducted on the ship, and it should be finished by the end of the day today. That's what the captain of the ship has been telling its passengers. And if the passenger tests negative, then that passenger will be able to disembark the ship 19th of February onwards. And it might take until the 22nd of February. That's because it may take time for all the results to come out. Yes, the government has expanded its capability of testing samples. Until now, only sample tests of 100 or so cases could be conducted. But from Tuesday onward, the government says that it will be able to test sample 3,000. So that will be a huge increase. But the passengers has to test negative. Now, there are passengers who have been disembarking the vessel. It was first the Americans, about 300 plus have disembarked the vessels to fly back to the U.S. on government chartered flights, and it's believed the Canadians will be able to disembark on Tuesday, and followed by the Australians. And Chief Cabinet Secretary Yoshihide Suga has been saying that also Italy and Hong Kong have been requesting the Japanese government for them to allow to bring in their chartered government aircrafts.
Mitch, the number of confirmed cases has also been increasing on land. How is Japan handling the situation?
Well, yes, some experts are saying that, this could be the acceleration stage for Japan in terms of a community infection of the virus. One major event was the New Year's party on the Yakatabune, or boat ride, a small boat ride with sake and dinner. And these were Tokyo taxi drivers. And this was in January. So there was a long incubation period, but it was during the past few days that a lot of people tested positive, 11 in all. And it's believed that these people were on a boat which was also used by people from Wuhan some days before. And there is a possibility that the staff who served the passengers from Wuhan and the taxi drivers were the same staff. And perhaps through the staff, these taxi drivers contracted the virus. And another, Wakayama Prefecture in Japan. Now, hospital has been infected with the virus. It started with a doctor, and possibly spreading to other hospitals, because this doctor also went to another hospital after he was feeling ill. So this is another worrisome case. And also, going back to the taxi driver, the first case of a taxi driver, he was the son-in-law of the woman who died. She was the first case of death from the COVID-19 virus. And then we heard that a nurse who took care of this lady was tested positive. So it's spreading and spreading, so it's worrisome. But a bit of good news is 13 people who tested positive on land, they have been discharged from hospital.
All right, thanks for that, Michio Ishida, speaking to us from Tokyo.